Bonjour, اليوم معي دكتورة هانية. She's our dermatologist at كلينكا Joelle and hair restoration surgeon. Good morning.
Hello, good morning, Joelle. Thank you, I'm fine. Thank you.
I want to find out what are the different techniques that we have at Clínica Joelle and what are your favorite techniques for hair transplants and when do you decide to do each technique?
So we are performing two techniques. One is the old technique, which is a surgical technique, which is a strip technique. That means we are removing a part of skin on the back of the head with complete hair. More than 1,000 to 3,000 hairs are harvesting, and we implant after repairing and preparing the hair in the front side, which is the affected area. That is the old technique, which we still use at Clínica Joelle for special cases.
Such as?
For example, for females, the females, you know, they have a long hair, so we can't make shaving, what is a part of the second technique. If we want to go for the modern technique, which we usually at Clínica Joelle, approximately about 85% of our hair transplantation are the second technique, the FUE. In this case, we are shaving the donor area, the area where we get the hairs, the harvesting part, and we do harvesting one by one. Which kind of patients? All men. And special in cases if patients want to go for the eyebrow restoration. And the eyebrow restoration, if they don't need so much hair, it's no need to do a small surgery. We can do shaving and minimally.
I almost like my heart stopped because we're going to go into that later on in another episode. But because I'm looking to do eyebrow hair restoration, and I thought you meant if I need to do that, I need to shave. But no, you're saying you can use the second technique.
Okay. But welcome at Clínica Joelle.
Let's see, we'll come to that another time. So the two techniques, the old-fashioned one you're saying, the one where you cut a strip at the back, the end result is literally just a line. So when women are watching us, they don't need to be petrified. It's literally a very thin line.
If patients are following our instruction, I will promise them that the strip and the skull will not be visible.
Okay, very good, because that's maybe the biggest worry. The two techniques, is there more hair from one technique to the other? Is there more hair guaranteed?
No.
No.
We do guarantee for both of them. Important is where we are taking the hair. Okay, if the area is good, the result is the same.
But you prefer to use the second technique, the one without the cutting, more these days, right?
Because we have, of course, more male patients who are undergoing this treatment. About 70% of our patients are male, 30% are female, and that is why the results are more FUE, the modern technique, one by one, than the others.
Thank you so much.
You're welcome.